Requesting Shreya to be on stage for your presentation.
I just wanted to say I really like the framing you used of the trees and the emotional component, sir. I think you really moved everyone in the room today, BP Ravi sir, with talking about the voiceless biosphere, which is really hurting and how we all have to improve it. And I can say from our entire team, it's been an absolute pleasure working with a visionary like you. And it's been an absolute pleasure working with BAF as well. And just for the record, so I've drunk Vikas Pramava's water before. When we visited his Orion Mall plant. So I'll just give a brief introduction about Well Labs. I think Veena already touched upon this, but we are a new center. We're less than 2 years old, and we were incubated at A3, and we spun off into our own entity, and now we are a center within IFMR. And we really work on, as the name implies, water, environment, land, and livelihoods to create evidence-based solutions for improving human quality of life while nurturing the environment. And we have a really diverse team. Even the team here, you'll see that there's every single person on our team has a different discipline almost. So we have data scientists and engineers, hydrologists and geologists, economists, sociologists, community builders, entrepreneurs, and urban planners. Today, I really want to talk about what we did at the Urban Water Program to quantify the flows of water through Bangalore, which we would like to believe is a starting point for making better decisions. BP Ravi sir very nicely put how the problem really started with us pumping water from the Kaveri, which was really far away, and as a result, our cascading lake system, which Bangalore has, sort of became less important. And what we try to do is actually quantify the flows of water through the city and explain the areas which actually hold the most promise for changing the current paradigm, which is where we're drawing out nearly 50% of our water from groundwater, which is why we're facing this water crisis so acutely in Bangalore. Our Kaveri supply has remained the same. However, our groundwater is what we've really all been dependent on. So I'll just break down how we went about doing this. This is the more scientific version of that same image. But we really did analyze the flows of water into the city, where it is actually consumed, and what happens once it's treated, and where it goes downstream. So starting with the rain that we get into the city, we get about 1,807 MLD of rain every day during the monsoon months. And that is really concentrated over a span of around 4 months. And some of that rain, the rain which is outside the catchment, is where we get the Kaveri water from. So that's like BP Ravi said, it's only like a third of our city is actually sitting in the Kaveri basin, and the rest are actually sitting in a different basin. And we also get about 1392 MLD from groundwater. So the numbers are almost equal between the Kaveri water and the groundwater. And after we actually, that's the sources of water, and the way they're supplied is 55% of the water supply is public, that is municipal supply, that's the pipelines you actually see in blue, and 45% is private. So what's interesting is from this map, it looks like, oh, there are such few areas of the city that have private supply, but when you overlay a population map, you very clearly understand that actually, even though those pockets are sort of concentrated to the periphery, that's where most of the population now lives. So most people are actually groundwater dependent on the periphery of the city completely. And then we looked at how this is actually consumed and what happens to the water once it's actually supplied. And domestic supply is the largest consumer. We actually have about 1,807 MLD being consumed in domestic supply. Our total overall consumption has been estimated at 2,600 MLD, and that goes up and down depending on the season. In the dry months, that can actually increase quite a bit. And what we really noticed from this was that the seasonal water demand is something that hasn't really been looked at. And if you look at the dry months when water supply is the lowest, that's where industrial and construction demand is the highest. After that, we looked at where the water actually goes once it's treated. And Bangalore is doing really well on the front of it actually treating most of its wastewater. However, reuse within the city is very poor. We have approximately 76% of the water being treated. The installed capacity for centralized sewage treatment plants is around 1500 MLD, but the amount they're actually treating is about 1239 MLD. And decentralized sewage treatment plants actually have approximately 600 to 700 MLD, but the amount that's operational is only 340 MLD. But what's interesting is with this new policy directive, it's possible that that 600 MLD could actually be utilized completely because there's a financial incentive now in place to treat the water better and reuse water as well. And most of this treated and untreated water mixes together and ends up in lakes, which actually renders it unusable and also causes the lakes to eutrophy or lake health to be reduced because of the fact that the untreated water is so rich in nutrients. However, if these lakes were desilted and filled up, they have immense potential to actually store treated water and rainwater. And we know that most of the lakes are receiving sewage because 43% of the total lake capacity is full throughout the year, which is an indication that they're receiving water perennially. And 2/3 of the wastewater enters the cascading lake system. And the remaining wastewater actually goes, some of it evaporates, some of it is now sent to rural and peri-urban areas. So this is the basin diagram, so you can tell that the Kaveri Basin, which is in the red, is actually covering only a portion of the city. And we also have these schemes where we're sending wastewater to Kolar, Chikballapur, and Tumkur is also planned. And that water is really essential now for the rural and peri-urban areas of the city because they are also not receiving the same rain that we are also not receiving. So it's really important to look at decentralized reuse for consumption within the city and maybe have a combination of reuse within the city from the centralized STPs, but also continuing to send them to peri-urban areas which are really parched. So we'd like to believe that once we have these numbers, this serves as a starting point for making better decisions for the city. And we'll just illustrate what we can do now that we have the baseline. So like I mentioned, decentralized STPs account for 25% of the total sewage that's being treated in the city, which is around 340 MLD. And we looked at reasons why this sewage wasn't being used properly. This was a study done back in 2021, where we interviewed stakeholders from across the board who are involved with decentralized treatment, from RWAs to STP operators, builders, policy makers, and we identified 6 key reasons why decentralized sewage treatment plants were not being run properly. And the primary reason really was there was no economic case for wastewater reuse. But there's also other factors that really need to be looked at now, which is the perception of wastewater still remains to be something that needs to be addressed. And we have Josiane here sitting in the crowd, and I'll talk about our partnership in a bit, but we really started a partnership with IRWAG based on this study back in 2021, and ever since then we've really been talking about looking at addressing each of these points. So the study is broken into 4 work packages. The first one really looks at technology. What are the new innovations in technology that are needed in order to bring down the price of water but still have high quality scalable on-site reuse solutions? Because right now the standards which the Pollution Control Board has set out are perfect for reuse for landscape irrigation and to an extent toilet flushing. But for reuse in the construction sector or in industrial reuse, you really need better quality water, which is where systems like Vikasa system come in. But we want to see if there's a way to actually mainstream that and make that something that can be done at the apartment site through a mix of grey infrastructure and nature-based solutions. The second is acceptance, which is the work package that Josiane really leads, which is looking at what will it take for people to start wanting to reuse wastewater. And we realize there are close links with monitoring. And right now we stand at a crucial juncture where the economic case has been made, but we really need to ensure safety, because if safety is not ensured, then this entire thing can fall apart as quickly as it was put together. So our focus has really now moved to safety. And The other portion of it is what are the innovative business models that can actually drive more acceptance and safe reuse, and finally the governance, which I think we can all say is something that has already is ahead of the curve almost in this case. So this is the modeling exercise we did based on the water balance. So we looked at it for the Hebbal Nagwara Valley, and what we really looked at is how much water could be reused within the city for non-potable uses, namely for landscape irrigation, construction and industrial uses where wastewater is already accepted and is being reused, and finally for water body recharge. And what we found is that almost 64% of the valley's water could come from just reusing treated wastewater from a combination of central STPs and decentralized STPs. Which means that right now we're at 50%, we can easily reduce the amount of water. Right now we're at 97% fresh water coming from Kaveri and groundwater, but we can reduce that to 36%. So it has massive potential from the hydrological lens. We also have been doing a study along with EAWAG. EAWAG is part of the ETH domain in Zurich, and it's a Swiss national Swiss Federal Institute for Aquatic Sciences, and along with BAF, we did a study of 60 STPs in the Yelahanka zone. The Yelahanka zone has a total of 180 odd STPs, and we've done a third of that. And our findings clearly showed that regardless of the technology, the operation and maintenance costs really dropped once you cross the 100 KLD mark. And the reason for that, once we deep dived into the survey results, was that these STPs are incredibly complicated to operate, and they require skilled operators. And skilled operators really don't come cheap. And whether you have a system which is treating 20 KLD or you have a system treating 120 KLD, you still need one operator doing that. Now, there are companies that have come into the market which are using technology to monitor different parts of the system. However, their current price point is actually higher than hiring a skilled operator. So we really need to look at, from the business model lens, how that can be dropped. But we really do think having a service contract model should be a prerequisite to sales. And the reason I say that is, the standards that need to be complied with, for example, construction curing, is ISO 456-2000. Now, it really talks about 3 parameters which are not measured currently in the KSPCB norms, which is the sulfates and the chlorides, and to a certain extent, just making sure that it does say that the source of water needs to be potable in the guidelines. However, we do think the reason it says potable is because potable water actually tends to remain consistent. Wastewater could also be consistent if the systems were being operated correctly. And one way to ensure the system is operated correctly is to get someone who knows what they're doing to operate it, rather than somebody who is just flipping a few switches or eyeballing chemical doses. So what we really want to do is work on a framework for how you can assure consistent treatment. And I'll just get to what EAWAG has done for San Francisco, and it's a model we think that could be applied to Bangalore. So there are 2 ways you can approach this. You can approach it by monitoring parameters right at the end of the treatment process, and there are some parameters which are easy to monitor. Of course, we have to bear in mind here, the systems in San Francisco all have real-time monitoring systems, which cost around 17 lakhs if you're going to be measuring in real-time COD. So that's not viable for the Indian context. However, there is a second system which they use, which is a risk-based approach, which basically says if all the parts of the system are running in harmony and in a particular cadence, then you can actually predict to a high level of accuracy what is the end quality of water. So what they've actually created is a log frame for that. Over here, they really care about pathogens because reuse is mainly hygienic reuse, which is basically for showering. And what they've done over here is said, if you have an activated sludge process, this is your typical log reduction value. So now this is for pathogens, but we could very well reframe what are the parameters we really need to be looking for and create a similar framework for Bangalore. So then, because the biggest issue with sewage treatment plants are that they're not standardized, and standardization is incredibly hard to do because of the fact that it's much cheaper to cast tanks in concrete for builders while they're building systems rather than buy a plug-and-play model that comes and sits there. And for that reason, you have maybe 70% of the STP stock has SPR systems. And if you look at each of those SPR systems, no two systems are alike. And so it's incredibly hard to consistently assure you're going to get good treatment at the end of it. However, there are some key points that need to be taken into consideration for those systems, and a combination of IoT sensors and machine learning algorithms can actually tell you if those systems are running well. So what we are really proposing is a framework for monitoring and maybe a service contract model as a prerequisite to sales to ensure that there is quality. Yeah, thank you. Yeah. This one? This one? Yeah. So I'll talk about the two end users that show the most promise. So construction, curing. If you look at it, they're asking for chemical oxygen demand, biological oxygen demand, TSS, pH, sulfates, chlorides. So they're not actually measuring fecal coliforms. And fecal coliforms with wastewater are really important because at the end of the day, you have workers. I practiced as an architect for more than a decade. So if somebody has a cut on their hand, they're in trouble if that water has pathogens in it. So I think that's why we're saying that having a framework in place that ensures pathogens are also removed, because that should be the starting point for any reuse, that pathogens are removed. Because right now there's a loophole. You can measure for this, but you have to make sure the plant is actually meeting the KSPCB standards. And the KSPCB standards are being measured once a month. Now, it's possible that those standards are actually being met by the plant, and there are a few operators that will take the effort to measure it more consistently, but that framework needs to be formulated and in place now as a guideline. Yeah. Yes. So the thing is, international ISO standards have been, contextualized for construction in the Indian context, because if you actually look at how construction is done around the world, it's very different. So even though it's ISO standards, it has been contextualized for the Indian context. BIS doesn't have it's not the norm that is being followed, but however, BIS is considering now putting out standards for wastewater reuse in construction. But the science. Sorry. So in Bangalore, we have a path dependency. We already have 3,000 sewage treatment plants, and they're already constructed and they're already run. I think there are two things that we need to look at. One is what is the ideal treatment state? And really there, I think more than standardization, because that still requires enforcement and somebody going and checking those systems, and which is impossible to do. Perhaps brands can act as a proxy for that, and there could be a way that could actually be, because nobody comes and checks our RO system sitting in our kitchens. Why can't the STP actually become that way? But the path dependency that we have is not negligible, right? We have 25% of the city sewage actually being treated in those STPs. So for those systems, really looking at what is an innovative model now to ensure quality, and I think operation is actually one of the key things. So we visited plants a couple of times. The plant design is only one component, but operating it is as important. So yeah. 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 So we'll have to redesign this for the context of Bangalore. This has been done for San Francisco, where they really care about hygienic reuse. But the probability that we are looking at, so AIRWAG actually conducted a study where they looked at whether residual chlorine, which is very easy with a low-cost sensor to measure, is sufficient as a parameter to ensure that the water is safe for reuse. And what they found is it is not sufficient unless the plant is actually being operated consistently. Because fecal coliforms is sort of like a basket parameter to see if you actually have any kind of pathogens in the water. However, that assumes the baseline for that catch-all sort of parameter assumes the system is running in a consistent manner. And so when they actually checked residual chlorine as a parameter and they checked fecal coliforms, they were not matching. So, which is why, and the thing is, this sounds really complicated, but actually, it can easily be standardized just through technology now, where you just have a series of IoT sensors at different points for different technologies. SPR being the most popular technology should be the first one that's addressed, and so on and so forth. Yeah. They measure chlorine, yeah, residual chlorine, yeah, yeah. There is once a month is supposed to be the standard. However, we know for a fact that's not always being followed. Perhaps now with the incentive for sales, that can be advocated for more. Uh, but even in an STP, so there were consistent water quality tests done for all the parameters every single day for a month, and the amount of variability was very high. So it's not as if you tested once a month and you know that system is working well. And also the opposite is proving to be true, because now there are people who are actually transporting wastewater and they're checking 20 systems and they're saying on this day the system wasn't running well, so they just write it off. And then that's a huge missed business opportunity as well, right? So one option could just be to ensure that the system starts running properly. And it is a very complicated thing to do. There are people who just specialize in STP audits and running systems. But we think that in order to ensure, because this will emerge as a new business model again, so to ensure that there's some quality in that as well, trying to use some kind of technology where you can actually see the results consistently would be the right way forward. Yeah. Yeah. There are these cheap deep dip test kits. Actually, maybe Shashank, you want to talk about the dip test?
Whatever has 20, less than 20 rupees for a test, or just 20. Yeah, those can be the ones which BF can take up and put up.
I think one of the tasks going forward and as an outcome of this workshop would be to create standard operating procedures and processes on how the quality assessment and happens at exchange points.
See, as long as people start seeing it that this is what is happening and achieve once it testing is changed, they push for that change.
Yeah.
That's one of the ways.
I just also wanted to mention that CDD is going to be
Helping with the creation of this framework through the monitoring and
from the testing point of it, there are very simple called like H2S wells. I think Vishwanath sir will definitely say. This is something every primary healthcare center is being using it. It just requires a just visual observation. You put a water in that well, leave it for 24 hours. Tomorrow morning you have a results. Very simple as such. It is something that we can use. There are, like as Shashank said, there are definitely in terms of quantity and quality also. But I think these are very simple tests that we can easily conduct. Anybody can do it. Even our Asha Karyakartas are doing this for a quite long time now.
I think one thing that we really wanted to ensure, the reason we didn't advocate for dip test kits, which was something that we initially were, is how do you make sure people are actually doing it? So, I mean, that again becomes something which can sort of easily be overlooked. But
The
the
incentives are there. Right? Now the economics is there.
share more with you? You had more slides.
No, no
So
slide.
conversation is also useful.
I just wanted to say, no, that's exactly. But I just wanted to say we did work on an SOP for reuse and greening, where the recommendation was a dip test kit. And what we realized is it was only done once. It was not done again. So, yeah, but I'm just saying that if everything was left to people monitoring, I think we should also think about a more systematic way where it's not dependent on the will of a particular apartment or particular operator, because we're talking to the most motivated group here. So, yeah. Thank you. That's all I had.